Symptoms of high blood pressure. Here's what you need to know about the level of high blood pressure. How you can lower your blood pressure using different treatments. The majority of people with hypertension suffer from what is known as essential hypertension. Hypertension with no known cause. What is called primary or essential hypertension is a combination of two types of hypertension symptoms. High blood pressure of the blood vessels. High blood pressure, also known as hypertension, is when the force is too high and begins to damage the body. The blood flows through the arteries with increasing force. When the pressure in the arteries becomes too low, it can cause problems with the heart, lungs, and kidneys. But it has no effect on other parts of the body such as the eyes, ears, skin or lungs. Although many things can affect blood pressure during the day, and a single high reading could be just a single reading, off. That doesn't necessarily mean you have high blood pressure. High blood pressure can cause symptoms. So it's important to be proactive and find out what your blood pressure is. If your values are constant 140 to 90 millimeters of mercury or higher over several weeks, you may be diagnosed with hypertension or high blood pressure. Your healthcare provider will want to see several blood pressure readings before making a diagnosis and starting treatment. Your doctor will be able to measure your blood pressure over time to confirm whether you have high blood pressure or not. A doctor will want to have seen several blood pressure readings to make a diagnosis of high blood pressure before initiating treatment for you. To diagnose high blood pressure or to begin treatment, you should consult a doctor. If the blood pressure, measured 3 times, is greater than 140/90ths, the person has high blood pressure. If your blood pressure stays high for more than 3 days in a row or for more than 2 days, it is considered high blood pressure. In other words, if your blood pressure is above 120/80ths for 3 consecutive days or more, you should consider high blood pressure. A person may have higher blood pressure if he or she has taken a blood pressure measurement on 2 different days, on each of the 3 occasions in the last 2 weeks or less, i.e. a total of 3 readings of 140/90ths. Since a person's blood pressure can depend on a number of factors, including the time of day, doctors check blood pressure at different times of day to make a diagnosis. For someone with high blood pressure, to ensure that high blood pressure is not caused by anxiety, the doctor sometimes monitors the person's blood pressure for a whole day. If you think you have high blood pressure, talk to your health team to tell them if you have it under control or have any symptoms. It is important to share this with others to learn more about who you are when you may have life-threatening blood pressure complications. If you regularly check your blood pressure, you can pick it up, but it is not usually a symptom. One of the best ways to find out who has high blood pressure is to have it checked regularly and know if it is present or if it is. High blood pressure is the medical term for hypertension, but it does not refer to nervous or agitated or emotional conditions. If you have hypertension without a known cause, it is called essential hypertension or primary hypertension. Some women develop preeclampsia during pregnancy, while others are thought to have high blood pressure or chronic high blood pressure during pregnancy. Preeclampsia can also develop in someone who has other conditions such as diabetes, heart disease, kidney failure or cancer. You may experience symptoms of hypertension such as headache, dizziness, nausea, vomiting, diarrhea, abdominal pain, muscle pain, fatigue and nausea. If you have high blood pressure, have it checked regularly and see a doctor who monitors these conditions. Even if you have not been diagnosed with high blood pressure or if you have a family history of it, it is important to have your blood pressure checked at your annual checkup. If you are under high blood pressure, treatment is the first step to getting your blood pressure back to normal. The only way to know if you have high blood pressure is to have it measured with a blood pressure cuff. Just because one blood pressure level is higher than the other does not mean that you have high blood pressure. The only way to find out if I have higher blood pressure is by taking a blood pressure test. One of the best ways to know if someone has high blood pressure is to have their blood pressure checked. But the only time you can say for sure if he or she has it is when he or she has it checked at his or her annual checkup. The following recipes are used to lower high blood pressure. 1. Eat watermelon with a touch of cardamom and coriander. 2. Mix 2 parts of fresh orange juice with 1 part of young coconut water. Drink a cup up to 3 times daily. 3. Drink a cup of mango juice. 1 hour later take a 1/2 cup of warm milk with a pinch of nutmeg and cardamom. 4. Combine 3 tablespoons organic ACV. 1/4 teaspoon baking soda. 1 teaspoon cinnamon. 1/2 teaspoon cayenne. Mix together in 1/2 glass of water. Drink twice daily. Cause of high blood pressure. High blood pressure, which is sometimes called hypertension, is a disease that affects the blood vessels in the heart, kidneys, liver, lungs and other parts of the body. It increases the risk of heart disease, stroke, heart attack, kidney failure, and stroke. Treatment of hypertension depends on the associated risk of developing diabetes, high cholesterol, obesity, diabetes, and high blood pressure, and other diseases, taking into account several factors. Hypertension is directly caused by a combination of factors, such as age, gender, birth age, blood sugar levels, cholesterol levels, and diet. If you have high blood pressure, your doctor will also consider other diseases and disorders, such as diabetes, high cholesterol, obesity, diabetes and other diseases if poorly treated, as well as the risk of raising blood pressure. Your doctor may recommend a change in your heart-healthy lifestyle to control your blood pressure and prevent you from developing it. In addition to a positive lifestyle change, people with high blood pressure may also need to take medication to control their blood flow and cholesterol levels. If you have high blood pressure, your doctor may recommend adopting a lifelong heart and healthy lifestyle changes to lower and control it. There are many types of blood pressure medication, and you may need to take more than one if you are taking one. If you are treated for high blood pressure, the risk of heart disease increases with the number of medications available for treatment and the number of medications you have available. According to the U.S. Centers for Disease Control and Prevention (CDC) and the American College of Cardiology (ACB), if you have high blood pressure and need the help of a doctor or other healthcare provider, if you are taking medication to lower your blood pressure for the rest of your life, if you have a history of high blood pressure or have risk factors for it, you may need more frequent measurements. If you are under 40 years of age or older, 18 to 39, and at high risk for high blood pressure, ask your doctor for a blood pressure reading every 2 weeks for the last 12 months or more. According to the U.S. Centers for Disease Control and Prevention (CDC) and the American College of Cardiology (ACB), if you are 40 years old or in the high-risk group of 18 to 39-year-olds who are at higher risk of high blood pressure, ask a doctor to measure your blood pressure every 2 weeks or less for at least 6 months. The best way to know if you have high blood pressure is to have it checked by your doctor at least once a month for the last 12 months. According to the CDC, just because one blood pressure level is higher than the other does not mean that you know the number or have higher blood pressure. Hypertension is when the force in the blood is too high due to heart contractions or relaxation of the arteries. It is also called high pressure when too much force is pressed against the artery walls. In high blood pressure or hypertension, the pressure on the vessel walls is often too high. High blood pressure increases the workload of the heart, which can affect its ability to pump blood and lead to a heart attack. When your heart enlarges or is no longer able to supply your body with blood, it can cause heart failure, heart attacks and strokes. If the pressure in the arteries becomes too high, you will have high blood pressure, also known as hypertension. It is not only the heart, because all parts of the body are dependent on blood circulation and can affect the heart. While normal blood pressure is necessary for survival, high blood pressure can be dangerous because it means your heart has to work much harder to pump blood through the body. The higher the blood pressure, the more likely you are to have problems, whether you have had it or not. It is possible to develop heart disease and kidney problems. If you know you have high blood pressure as well as other health problems such as diabetes, heart failure and stroke, the only way to find out if you have high blood pressure is to have it checked by a doctor in your GP surgery, hospital or another healthcare provider. To diagnose high blood pressure, your doctors need to know if and how high your blood pressure is during the day. Doctors will sometimes track a person's blood pressure throughout the day to ensure anxiety does not cause high blood pressure readings. When the disease that causes high blood pressure can be resolved, the individual's blood pressure normalizes. If you have high blood pressure, the blood flows so fast that you cannot feel it. And the excessive pressure on the artery walls caused by this can damage your arteries. While arteries used to be stretchy to cope with rising and falling blood pressure, with high blood pressure, they lose their stretchability and become stiffer and narrower. Here are a couple of tips that may help you. 1. Massage top of neck until it feels loose. This stimulates the vagus nerve, which may lead to a drop in blood pressure. 2. Juice vegetables and herbs high in magnesium such as cucumbers and parsley. Mix them with carrots. 3. Eat according to your blood type. For example, blood type O should avoid cucumbers, nutmeg and all forms of wheat and flour. Some people don't realize that flour is made with wheat. Blood type B should avoid chicken. 4. Exercise daily. 5. Do a liver flush.